Folks, welcome back to Kansas City. Today we're going to talk about two separate things, or two things that people think are separate. For those of you who are in the know, already know this, but we're going to talk about the Affordable Care Act and Obamacare. Now, flash to the future of this conversation, they're the same thing. Now, whenever you are out in the public, we're talking about something a little bit deeper when we talk about the difference between these two things. When the American public was asked, do you support Obamacare? Something like 60% of America said no. When they were asked, do you support the Affordable Care Act? Something like 60% of America said yes. Now, you might be asking the really smart people in the room, if they're the same thing, why are people giving different answers? People understand things differently based around the words that are used to describe them. Now, the old thing that a lot of people talk about is, what is the difference between manipulation and influence? And it's intent, at least in my opinion. Now, when people say this is Obamacare, they're trying to associate the price increases that have resulted from the either unintended effects or the unthought out effects of this program, and trying to associate it with one political party. Now, the other side of this argument is saying it's the Affordable Care Act, and they're trying to associate this set of regulations with what at least I believe they tried to do, which is make things more affordable. They failed at that miserably, but they tried to make things more affordable. And who doesn't like Affordable Care Act? The point is, the names are actually both subtle forms of persuasion. Who doesn't like affordable care? Right? It's already influencing your thoughts on that program. If you call it the Obamacare program, you're already associating things with that. So whenever you think of names of programs, it's better not to think of what they actually call it. It's better to think of it of what it actually does. There's a different philosophical point here, but to stay a little higher level, a thing is what it does. A system is the results it gets. Now, if you look at the fully insured model, which is a great name, what you, in my opinion, might want to call it is the opacity pay model, because you have no idea where any of your money goes. You're paying as a business owner, depends on the size of your business, but tens of thousands of dollars a month. You have no idea. It's opaque. The result of the system is 12 checks. The result of the system is a benefit program for your employees that you have no idea if you're getting a good deal on. So you can call it fully insured. You can call it the opacity model. You can call it the legacy model. You can call it the system that the hospitals and the doctors invented in this country to make sure that they got paid, which is the largest player, some of the largest players in this industry. That's where they started, as a way to guarantee payment for the providers, not for the patients, not for the members. Now, there's the other side of the equation, which is called self-funding. Now, that in and of itself is a really bad name, because who can self-fund their own health care? Well, that's why very, very few can, right? Very large corporations can, very large institutions. But when you put widgets on top of it, you create something better. Now, it's still self-funded at the chassis, but the effect of the thing, what the thing actually does, what it should be called, is it provides transparency. It's a transparent plan. It's a trackable plan. It's an auditable plan. And if you do not have data, you cannot make good decisions. There's an old rule. If someone is hiding something from you, it's almost never in your benefit. It's only in theirs, or else it wouldn't be secret. So when you look at these two models, sure, the common names are fully insured and self-funded, fully insured and level funded. What they actually do is provide health coverage or ways to bear the risk of health claims in these United States, but they do it in slightly different ways. One is incredibly opaque. The other is incredibly transparent, or should be. Now, there's mild exceptions to all of these rules. But if you want to change something, the first thing you need to know is where the money goes. And transparency is the best way to do that. They say sunshine is the best disinfectant. So bring transparency to your health plans and disinfect a little bit of this nebulous Wall Street big corporation stuff that says, here's what it is, and don't worry about it. You're not smart enough to understand it anyway. You can say, okay, that's fine. And you can outsource your responsibility. But when you outsource your responsibility, it's the Machiavellian or the very, very bad actor who's attracted to that. And there's a famous quote here from one of the founders of our country, one of the founders of this beautiful nation, Benjamin Franklin, who, if you haven't looked into him, man, that guy was a dynamo. People willing to trade essential freedom for temporary security deserve neither and will lose both. Folks, that is a brutal line. But if you're not responsible for your company, if you're not responsible for your people, somebody else will step in that gap and they will serve themselves if it's opaque instead of serving the people that you care about and go to work for each and every day. We'll see you out there. Keep fighting for Main Street. We're here if you need some level-funded help. All right.